update on what's going on with COVID-19. Yes, COVID-19, the coronavirus still with us. And our update with Imperial County Public Health Department Director Janette Angulo. Good morning, Janette.
Good morning, Carroll.
Well, it's another beautiful day in our neighborhood, isn't it?
It is. It's a beautiful day.
Okay. So, COVID, coronavirus, it's still with us, right?
It's still with us. It's still with us. We're still doing testing, and we're still identifying a case here, a case there. We currently are reporting a case rate of 1.6 cases per 100,000. These are 1.6 cases per day. And our positivity percent is low, 2.2%, Carol. So good to see those numbers.
Okay. Not bad numbers at all. How does that rate statewide?
Statewide, you know what? We are getting there. The state average is usually a little lower than the Imperial County average. The state is no longer keeping track of how each of the counties are doing, but throughout California, the case rate and positivity rate has remained pretty low, Carol.
Okay. Now, one of the things we keep hearing about is the variants of the COVID virus. And, have we seen that in the Valley?
We have. And variants, viruses constantly change through mutations, and those mutations create new strains of the virus, and those are what are called variants. Now, in Imperial County, or let me backtrack, in California, several types of variants have been identified. I see six on the list. That we have B117, B1351, P1, and so forth and so on. Now they've assigned lettering. So we have the gamma, the alpha, the epsilon, and so forth and so on. In Imperial County, we have identified 125 variants of concern. Most of the variants of concern in Imperial County are the alpha and the gamma. The gamma is the P1 and the alpha is the B117. And then we've also identified the epsilon, the B1427 and the B1429. Those were known as the California variants, those last two. Okay. And then we've identified some variants of interest in Imperial County as well. So it is here, small amount, but we've identified some.
Okay. Now, vaccinations are ongoing. Where might I get vaccinated? And can I just walk in?
Yes. A lot of sites in Imperial County. If you visit vaccines.gov, you'll see that over 30 sites appear. And these sites include hospitals, community clinics, pharmacies, the local health department sites. And we still have up and running the Optum Serve site over in Imperial at the Veterans Hall. And you'll see our clinics posted, the dates on our website. We usually have 2-3 days out of the week over at the Department of Social Services. And then we're out and about. Recently, we did quite a bit of work with schools and community centers. And that's just the public health department. Again, there's a lot going on, many vaccine access points. Another good way to access vaccines is through myturn.ca.gov. But at this point in time, it's either an appointment or walk-in. Both are welcomed.
Okay, so you can walk in. And there are some incentives, right?
Incentives. Well, a lot of the incentives that California was offering are no longer there. I did not become a millionaire. I did not win the lottery. But there were many individuals throughout California who got vaccinated and were selected. If we remember, there were 10 winners of that $1.5 million, and then several winners of the $50,000. So a lot of those incentives are gone. There may be new incentives for information about incentives when you're getting vaccinated. It's COVID19.ca.gov.
Okay, the incentive should be I'm going to protect myself and everybody else by getting vaccinated.
Absolutely. That's the main and greatest incentive.
Okay, and again, we will say walk-ins are accepted, and particularly, I know, at the Veterans Hall in Imperial.
Yes, absolutely. Veterans Hall, the Department of Social Services, walk-ins are accepted.
Okay, what about testing?
Mm-hmm. Testing is still available. We still have the mobile units in Imperial County. In Brawley, we had the fixed site. As of this coming week, that site will be located at Del Rio Community School. The Brawley Senior Center will start operating its regular activities, in July. So we needed to find a new space, and in Brawley, like I said, Del Rio Community School will be housed in that area. Testing through the OptumServe site will be available at least until October of this year. There's also testing going on throughout the community at other provider sites. There may be a cost attached to that testing, but at the OptumServe site, it continues to be free.
Okay, and we should point out that the OptumServe site's free, and it's easy to register online. Not a big issue. Even I was able to handle that, and the vaccination is free as well. Now, they may ask you if you have insurance, and they may bill your carrier, but there's no out-of-pocket expense for the vaccine.
No out-of-pocket expense for the vaccine or the testing. So no, for the individual, no out-of-pocket cost.
Okay. Now, we've got those numbers out of the way. Lots of questions as I have been out and around, and I'm still careful. Do I have to wear a mask?
It depends, Carol. It depends. Well, for the most part, outdoors, no. If you are in a very crowded place, it's outdoors, you haven't been vaccinated, well, the recommendation is that you do because, again, the pandemic is still here. The virus is still here. So yeah, vaccinated people do not need to wear masks in most circumstances when they're outdoors. Indoors, unvaccinated people should wear masks in public settings. Now, there are some settings, regardless of vaccination status, that you need to continue masking. This includes public transit, hospitals, long-term care facilities, homeless shelters, indoors and K-12 schools, childcare, and other youth settings. Also, jails and other types of congregate living settings. So there are places where the community still needs to mask. And if you take a look at K-12 schools, the younger individuals younger than 12, they haven't been vaccinated. So we still need to do our due diligence to protect those that have not been vaccinated. Now, on K-12, we are waiting for updated guidance updated recommendations from the Centers for Disease Control and Prevention. And as soon as those are out, the state of California will update its current K-12 school requirements, and we'll be sharing those with our community as soon as those are out.
Okay, and I know CalOSHA is in charge of the regulations for workplace environment.
That is right, CalOSHA. And that's really important because for those employers and employees that are subject to CalOSHA, well, what CalOSHA did is it aligned its mask requirements with the state masking requirements. So just really quick, no face covering requirements outdoors exist except when there's outbreaks. And this is regardless of vaccination status. Now, employers may allow fully vaccinated employees not to wear face covering indoors, but the employer must document their vaccination status. Again, there are some settings that regardless of vaccination status, they must wear a mask. And I just listed those out, the hospitals, the shelters, etc. Now, so those are the high-level kind of updates for that CalOSHA change and alignment with the state masking requirements.
Okay, and what about an employer mandating employees be vaccinated?
Well, that is still not in place. The mandate is still not in place. So individuals have the option to be vaccinated or not. Now, we have to remember, if unvaccinated, then the individual has to wear a mask. That's still within the standards.
Okay, and let's jump into, we've already talked about vaccinations and the positivity rate and everything. What about the vaccination rate? How are we doing with that?
Imperial County is doing awesome. In Imperial County, we have 75.8% of our eligible population with at least one dose of the vaccine. And so eligible population is individuals 12 and older. Now, fully vaccinated, we have 55.3%, and partially vaccinated, 16.5%. Partially vaccinated means that they're waiting for the second dose of Moderna or the second dose of Pfizer. If we get the 16.5% to be fully vaccinated in the next month or so, we're going to be pretty high up there in the fully vaccinated percent. So slowly but surely, we're getting there, Carroll.
Okay, and at that point, everybody in Imperial County will be able to wear a gold star on their forehead, right?
Yes.
Okay. And, again, on a personal level, I encourage people to get vaccinated. I understand some people have issues, but I think the numbers I heard earlier this morning, nationwide, 99.9% of the deaths that have occurred from COVID-19 in the past month or so were unvaccinated people. The number of people that have been vaccinated and have succumbed to the virus is, just a sliver of the full number.
And vaccination is a great tool that we have accessible to us. And you know what, part of it is, individuals do need to get the information, but get the information. And we've talked about it, Carroll. Get the information from a trusted source. And decide, yes, there are those that for one reason or another can't get the vaccine. But if there are any doubts, access these trusted sources, CDC, CDPH, look at our public health department website, talk to your doctor and get those questions, answered. So there are trusted sources out there.
Yes, count on the science. And, I have to, maybe I'm a little bit stilted. I was among the very first group to receive the Salk polio vaccine. And, that has made me a real believer in what science has been able to do, because I remember friends and classmates in iron lungs. And, science, Jonas Salk developed a vaccine that was effective. And this one may appear to have happened in a hurry, but there were so many people of science that developed it.
Absolutely. So. And vaccines in the United States came to change, a lot for us and so many benefits. And it's a great tool. And we've been able to eradicate some, diseases in the United States. So, yeah, you bring up great points. A lot of science, a lot of technology, a lot of time that has been spent on making sure that the community has this tool to help fight disease. So we highly, highly encourage that those that have not had a vaccine, there's a lot of opportunity to get vaccinated. Access one of those points, vaccination points, and whether it's Johnson & Johnson, Pfizer, or Moderna, all three are available in our community.
Okay. Have we missed anything?
No, I think we pretty much covered it, Carroll.
And we didn't miss Tony a bit.
Don't tell him that. Oh, goodness.
Okay. You have a great rest of the day and a great weekend. And, I'm not going to say you can relax yet, but, we can see progress. We can see positive things.
Exactly. We can see many, many positive things. And you're absolutely right. For public health and many agencies, this is not the end. It might slow down a little bit with transmission, but there's all that recovery work that still needs to be done. So we're still at it. We're still staying strong, and we're here for our community. It was really good talking to you, Carol, and likewise, have a wonderful weekend.
Okay, thank you. And we've been visiting with Janette Angulo, the Director, Imperial County Public Health Department, with another COVID-19 update.
The Imperial Valley's best oldies on the radio.
The best music all day.
And you'll be glad every night that you treated her right.
It's like a trip through time.